I'd like to invite David and Hillary and Linda up to the stage. These are a team of consultants who have come together through the Center for Practitioner Renewal. They have worked in everything from general practice to palliative care to support work to psychotherapy, all kinds of different aspects of healthcare. And the three of them have come up with a workshop that they're going to do with you today to really help you think through relationships in healthcare. There's been a lot of work that's gone into creating this morning, so I'm going to invite the three of them up to formally introduce themselves and set you off on this workshop together. So please welcome Hillary and David and Linda.
Go ahead.
Oh, okay, I'll sit in the end. Thank you. Very polite.
Thank you, Catherine, and thank you for the invitation you gave us to work with you in collaboration to set the day. I feel as though Jacqueline and Michelle just stole all our thunder. And if you listen carefully to what they said, it will be the message that we also hope will be integrated into what we have to offer today. By way of introduction, you can see the introductions. Hillary, Linda, and I have worked together in various capacities for the last 20 years or so with a variety of healthcare teams, with people in trauma, and work both individually with healthcare providers as well as with groups. Hillary is trained in education, in curriculum development, and is also trained in psychotherapy. Linda has a background in nursing and in social work, and I come to this field as an epidemiologist, as a physician, and also some training in psychology. So our training is quite diverse. Our values are very similar. And our conviction of working with healthcare teams to improve the care they provide to those that we love is our commitment. So today is about inviting you to participate in a process of how do we want to be together in the workplace. And that is a lot of work. And it would be false for us to have you believe that we can take you through the whole process, because we'd probably need at least 12 hours together to do so. Because as already been stated, we look at relationship in the workplace, our sense of self, our relationship with each other, and our relationships with patients. So just a standard disclosure. Healthcare is very complex. It's all of these things. And in 2003, Carl Roy, the then CEO of Providence Healthcare, said healthcare is based on a business model of efficiency. The work we do is about relationship. Our sense of self, our relationship with others, and perhaps also our relationship to something that is bigger than ourselves. And that has to do with how are we going to be together in the workplace. So we hope that today you will have a deeper understanding of who you are as an individual. And as much as Michelle said, I am not an illness, I am a person. I am not a doctor, I'm a person who has training in medicine. So that it is the self that comes to the workplace as much as the physician who comes to the workplace. So we hope that you have a sense of who you are and how that who you are will affect the people that you work with. And going back to Ian McWhinney is Canada's hero in terms of family practice. And in 1972, he defined patient-centered care, where really it is the best definition was given this morning, where we work collaboratively, where it's we looking at what can be done in your best interest. It's listening to understand that once you've given me your history, the differential diagnosis is already given, and that you have given me the information I need so we can together come up with a plan for how we're going to respond. And in the work that we did at Providence Healthcare with regard to the Center for Practitioner Renewal, when Carl Roy first invited me to lead that, I thought our work would be very focused on vicarious trauma, secondary trauma, moral distress, burnout, depression, and anxiety. And all of those features contributed to our work. But within 1 year, we realized that the greatest complexity in healthcare with regard to the work that we provide has to do not with our relationships with our patients, but our relationships with each other. And it's then that we began to explore, what does that mean? Because there are theoretical models asking questions, who am I? Who are you? Who are we? Because in essence, the very work we do invites the people who are experiencing illness, disease, injury, accident into our presence, and inviting us to respond to what's going on in their lives. And what we understand is that if we truly have a relationship with each other, at the core of what that might be, we will provide better quality care. Our work environment will be one that we are pleased to attend to. And one of the features that we often see has to do with what we call smiling rage. Hi, how are you? I'd like to kill you, but I won't because, I'll just keep smiling. And whenever I use this in a healthcare audience, this is the response. If I talk about smiling rage outside of healthcare, people don't get it. And what we have realized is we want to give people the skills and the ability to begin to have the conversation that moves from the smiling rage to the honesty of having been hurt, because it affects who we are, it affects our relationships with others. So that in essence, there are principles of relationship-centered care that didn't actually start in 2006, as you see in this slide. It started in 1994, when Ian McWhinney, along with a whole group of other people from the United States and Canada, got together and began to ask the difficult question about what is the optimal situation in providing care for patients. 1994. It took a long time for the concept of relationship-centered care to bubble to the surface, and it raised its head again in 2006 through an article written by Dr. Beach from Johns Hopkins. And basically what they're saying is, you are people, and then you are healthcare providers. And we are inviting you to bring all of that personhood to the bedside, who you are, not just the cognitive self. And that's the risk. And I've worked with the military for 15 years, based on the philosophy of Stoicism. If you have an emotion that's impeding your ability to function in the workplace, get rid of it. Don't exercise it. And that makes perfect sense. You can't say on the battlefield, oh, excuse me, I don't feel so good about this. It doesn't work. But healthcare is fashioned after the military, so Stoicism is very present. And Beach is inviting us to leave the Stoicism at the door. You have a heart and you have a mind, and can you bring both of those to the bedside? And all of this then also was reinforced by the triple aim, which is common to many people in terms of the Institute for Healthcare Improvement, where they talked about what do we want to do in terms of changing healthcare for the future. And I'm really pleased, and this is not a political announcement, I'm really pleased to say that the government of British Columbia added to the triple aim the notion that the satisfaction and the ability to function in the workplace, the satisfaction of the healthcare provider is equal to the satisfaction of the patient. It's phenomenal. It's landmark. And I wish every health authority would look at these three aims and take number 2 very seriously. It would change healthcare in this province. Because it has to do with listening. Listening to ourselves, listening to each other, and then ultimately together listening to and with the patient. Learning from Aesop's fables. 4 oxen lived together as a team. They were always together. When they would go down to the stream for water, they would go together because they realized there was a threat known as the lion. And as long as they were together and they put their butts together and their horns on the outside, the lion didn't have a possibility of breaking the team. And then one day, one of the oxen decided that he wanted to go to another part of the pasture to feed on his own. And the team was no more. What we need as teams is a sense of safety, inclusion, and trust. And trust means that I can bring all of myself into this team and it will be listened to, it'll be heard. We heard the word this morning, it will be respected. And that's what part of the work we want to do today. And today is just a taste. We hope it whets your appetite in terms of what does all of this mean. And we've learned a lot from Patrick Lencioni, who has written a lot about teams and how they function. And this is in the business world. And as you can see, the basic ingredient has to do with trust. And you know what's interesting? If you're a leader on your healthcare team, you're the most significant person to the word trust. Trust doesn't happen without vulnerability. Trust means I am honest enough, as the family doctor was in Michelle's case, to say, I'm not quite sure what's going on here. But maybe as a team, we can come together and figure it out. That's vulnerable. And the team is only as vulnerable as the leader. Here's a few other zingers for the leaders in the room. The organization is only as effective as the core value, as the soul of the leader. Individuals join organizations, they leave leaders. One of the most essential ingredients of job satisfaction has to do with a positive relationship with the leader. And only the employee can determine, or must determine first, if that's a positive relationship. If I'm the leader and I say, oh yeah, I got a great team, they like me, doesn't count. Ask the team. Power differential. It's true. Even if we're friends outside of work, power differential inside of work. Really important. And all of those four essential features of leadership have to do with trust. Won't go through the whole triangle. The other piece has to do with conflict. Healthcare providers avoid conflict because often we associate conflict with anger. Conflict is simply the difference of opinion. And if we can have a difference of opinion, rather than looking at it as either or and bring it together as both and, the third option, which is often the most appropriate option, will emerge. And so in our years together, what did we recognize in terms of healthcare? One of the most important features on teams is hurt people. Teams have hurt people on them, and hurt people hurt people. And how do we experience the hurt? Through bullying, through uncivil behavior, through all of these things. And you know, there's two words in healthcare that have become sort of very trendy, or four-letter words. One is respect, and the other one is bullying. We've sort of lost what they actually mean. I'm not a bully, but I can be uncivil. Not intentionally, ever, but if I withhold information that could make a positive difference for my team, and I don't give them that for a month or two, that might be experienced with them as being uncivil. So again, it's when we work with teams, we look at a continuum of civility to uncivil. And where are you? What are the features of your team that belong to all of those capacities? So that's what we explore as we work with teams. And you know, we don't talk so much about conflict resolution. We prefer to look at forgiveness and reconciliation, breach and repair, because those are the words of relationship. Conflict resolution are words of contract. And we really look very carefully at what are the words that we can use so that everything that we do emphasizes the notion of relationship and relationship-centered care. Because the principles, those four principles, and the essence of what I've talked about, are nudging us toward a transformation in healthcare. It's happening worldwide. And this conference is part of this new model of healthcare. And we see this about Fraser Health, actually. Fraser Health is leading in terms of what they've done through the ethics and the teaching of the people who are working at your tables. They're working to look at relationship and what difference does it make. This does not happen in every health authority. This does not happen in every province. It is happening in pockets across the country and in various parts of North America, where people are asking very seriously, how can we work together to nudge us all forward, to work collaboratively with compassion and empathy in a different way that provides the best possible care for the patients that we provide care for.